Hi, good afternoon, classmate. My name is Eric Shakor. I'm a nursing student at Brocketshire College. So what I'm doing today is a perineal care for men. So the purpose. So I've explained what is perineal care. So what is perineal care? Perineal care is a washing and drying of the private area of the person because the primary reason for washing and drying the perineal care for person is because it is prone to infection. So we need daily washing on it and have clean on it to prevent infection. So that is the perineal care. Hope you like it, guys, and watch my video. This is the perineal care for men. Thank you, guys. First thing that I will do is to assess the excoriation, odor and the discharges of the patient. So I will assess first, check on it, and that's the first thing that you will do in the perineal care for men. Second step for perineal care is to determine the perineal genital hygiene practices, self-care practices, and whether the patient is experiencing a discomfort in her perineal area. Ma'am, what are your practices of the genital care? What are your self-practices? Have you feeling discomfort on it? And that's the second step in the perineal care for men. For the third step in the perineal care is to explain to the patient what you are going to do. Hi sir, my name is Eric Shakor. I'm your nursing student for today. I will do a perineal care for you. Is it okay? We need to do the perineal cares to avoid infection on you because the private area are prone to infection, so we need to wash it daily and that's it. And then after explaining on it, you may wash your hands and dry it up. Provide privacy to the client. You may now wear your gloves. And you now fold the linen upward to clean the upper thigh and lower thigh of the patient. Now I will do the perineal care, sir. So I will clean the upper thigh and inner thigh. That's the third step of the perineal care. The fourth step of perineal care is to make the patient supine position. So he is in the supine position. I will now clean the upper thigh and lower thigh of the patient. Wash a dry cloth, and then wash his upper thigh and lower thigh. And that's the fourth step of the perineal care. Then after that is to inspect the perineal area if there is no particular areas of inflammation. So I will note the things that I've been seen in his perineal area. Also note the excessive discharges that the patient have. Since they have no, they are okay, they are fine. I will check it normal. And now guys, we will gonna do the sixth step of the perineal care is to wash the penis of the patient. Use a dry, use a wet, soft, cloth. Then I'm gonna wash first the head. And then the skin. Wash only. But make sure before washing on it, there's a towel on the bottom. So that to avoid wet. And that's the sixth step of the perineal care for men. Now for the second step is to inspect the orifices, intactness, inspect particular around the urethra in the client. And then in the eighth step is to clean between the buttocks and turn the client side facing away from you. So you will turn sideways and then clean his buttocks. I will clean his buttocks. And then the ninth step is pay particular anal area posterior. Pay attention to the anal area because you are washing the buttocks already. So keep on pay attention to the anal area. On the 10th step is to document all the unusual findings, skin breakdown, discharges, drainage, and any localized tenderness. And that's the 10th step of the perineal care. And that's it guys. Thank you for watching my perineal care for men. Hope you enjoy it guys and learn from it. And for the last step is you now remove your gloves. And then wash your hands again. And that's the last step of the perineal care for men. And I hope you enjoy it guys and continue watching and learn from it. And thank you for watching. And so what is perineal care again? Perineal care is the daily washing of the private area of the person, because the private area is prone to infection, so we need to prevent it from infection. Thank you for watching guys. Have a good day. Bye.